from Next Level Solutions. So Pete Sanford is with us. Hey, Pete, how you doing?
I'm great, Suzanne. How are you today?
Good, good. I hope you've enjoyed the day so far.
I have. It's been a jam-packed, chock full of info day. I can't tell you how many notes I've taken. The speakers have been great. I think the conversation has been really interesting, exciting. It's one of those, just when you think you know it all, there's something else that you learn. So I really appreciate the opportunity to be here, and certainly the effort that you and the folks at Global eLearning have put into pulling this off.
Well, we said at the outset, it's a live conference, so anything can and will happen. But fortunately, we've only had 1 or 2 speed bumps today. So I think I count us as very fortunate that we've managed to pull things off pretty smoothly thus far. And
yeah, I would say so. I mean, this virtual world today, just about any connection is acceptable. I think this one has been great, certainly a majority of the day.
Yeah. So good stuff. So you're going to talk to us today about learning in life-sustaining settings. And just to set that up, Pete, as I understand it, a lot of the work that you do is training your sales and other teams in the pharmaceutical industry, correct?
That is correct, Suzanne. Yes, our business is primarily focused in the world of life sciences, which is made up of pharmaceutical companies, medical device organizations, biotechnology companies, and things like that. People that really are kind of at the early part of the health and wellness process.
And I'm sure we'll hear from you about this, but I'll bet there's a little bit of compliance in there.
There is. Yep. There certainly is.
All right.
As well as a lot of clinical. Yep.
All right.
So,
well,
yeah,
listen,
I'm ready.
I believe we are going to let you share your screen.
Yes.
Okay. So we're going to let you share your screen, take it away for the presentation, and we'll see you back here in about 30 minutes.
Okay. I'm trying to see where I see my audio controls.
Yeah, it should be at the bottom. Can you ask to share his screen? You see at the bottom share screen?
I don't. I normally do. I see mute
you
for
might
audio.
Have to make your screen bigger.
Okay. There we go. Yes, it was hidden. Okay, give me a second here. Get over to the right screen. Share that. Okay.
All right. It's all you.
All right. Excellent. Well, thanks again, Suzanne, and thank you, everybody, certainly for your time this afternoon. It's great to be here. I very much appreciate this opportunity. Again, I am Pete Sandford. I'm the Executive Vice President of NXLevel Solutions, and I've been in this world of learning development for more than 30 years. 25 of those really focusing on technology-based learning for life science professionals. A little bit more about me, not that you really care, but I definitely am a people person. I like to interact with folks. So just in case you're wondering, I've been married for almost 30 years. I have 3 great kids and recently added a daughter-in-law to the family. So that's certainly exciting on our front. And that whole process involved a lot of learning that our whole family went through, especially in these COVID times. And I love to ski and to sail and to ride a bike. So enough about me. Let's get into learning. Next Level as a company has been around for more than 16 years. And as Susan and I just briefly discussed, what we really focus on, we're a learning and development and knowledge sustainment company. What we really focus on are working with organizations that really strongly work to improve patients' health. As one of the founders of the company for over 16 years, I've been heading up our business development efforts with our clients. So what exactly do we do? Well, as Susan touched on, and Suzanne and I touched on rather, we don't train the end patient or the end customer, so to speak. We focus on this area right up here, and which is on the left side of the screen, which are really the professionals in pharmaceutical, biotech, medical device organizations. They then train physicians and other medical professionals. And then finally, those medical professionals ultimately help to educate and work with patients. Give an example, some of the folks that we are tasked with training, in addition to sales representatives, medical science liaisons, disease specialists, access and reimbursement specialists, managers at all different levels. The way our company is structured, about half of our training is focused on the clinical side of things, product information, disease state, things like that. The other half is focused on the world of compliance. And it's a term that, people don't often like to talk about, but it is very critical, and certainly very important topic in this space in particular. And our whole philosophy relative to compliance training is the more people understand it, know what it is, know what they can and can't do, the higher level of confidence they will have when acting in this environment, and the better off everyone will be. Okay, so what I want to talk to you about today is a variety of things, but really my focus is going to be on presenting tactics, the various challenges rather, that our clients face, and the tactics and strategies that have been proven to be effective at overcoming these challenges. Our solutions don't involve the colorful animals that you see on screen right now, so don't worry about that. However, the relevance of these images to this presentation will come up in a little bit. So you may just want to make a mental note about what you're looking at the moment. Okay, so what are some of the learning and sustainment challenges in our space? Well, as we touched on briefly, it is highly regulated. And I don't mean to say that other industries don't face these challenges. Absolutely, they certainly do. So but I think the difference in our space is that the nature of what is done and the potential impact that what our clients do can have on humans, that some of these challenges are a little different than possibly they would be in other industries. So it's highly regulated. That in and of itself is a challenge. And that's, I don't mean any of these are bad. These are just things we have to consider and things to address when we're working with our clients to train their employees. In addition, the ever-evolving landscape. This statement in particular is not directly related to life sciences. It's the world we live in. But yes, the field of medicine and treatments and therapies is continually evolving. And that's a good thing. But in addition, you have access, fulfillment, and reimbursement. That's always changing. The compliance topic that we touched on, that is always changing. So it is always evolving, and that in and of itself keeps us very busy, frankly, but also makes it challenging to do what we need to do. Something people may not necessarily realize is our clients, the pharmaceutical customers, for example, don't directly sell to the folks that are going to be using their products. Now, they can market to them. Certainly that change came into place a while back, and we're all familiar with those ads and on TV that we see for medicines, as well as in other types of advertising. But ultimately, they don't sell directly to the customer. The customer can't go to AstraZeneca, for example, and pull up to their store and say, okay, give me the XYZ product. They have to work with physicians to get that prescribed and to actually get access to it. In addition, our customers, going back to the folks I was talking about, primarily sales representatives, may not know as much as the person they are trying to sell and educate, the medical professional, the doctor, the PharmD, the various people within the medical profession. So that creates some challenges and a lot of objections as well. In addition, not enough time made available for training. This is certainly not unique to the pharmaceutical industry, but it especially in this kind of world right now that we've spoken about so much today, where everyone seems like they're working all the time, it's very difficult to try to put dedicated time aside for training purposes. And that leads to an unrealistic balance between job responsibilities, my long list of things that I have to do relative to that, and then time I need to set aside for training. And then finally, which some of you may be able to relate to, and others will say, how could that possibly be? The understated value of training. And by that, I mean, yes, for the most part, our direct clients, the groups of training teams and training organizations and departments we work with, obviously value training, but they are constantly faced with, people at different levels, other stakeholders that don't necessarily have the same understanding and value in training that our direct clients do. So that's something we quite often have to try to help them with in terms of communication, but again, is another challenge that we need to work with our clients to get through. In addition, you have this thing called the forgetting curve. This is another challenge that's not unique to life sciences, and it's been around a long, long time. But frankly, it really hasn't been addressed that much until lately. The standard approach for educating adults and professionals has been typically a one-time event-based methodology. In other words, you may take some training at one time. That training could be an e-learning module, could be a workshop, could be a print manual of some sort. They were real big in our space for a long time. But whatever it is, it's essentially the philosophy that, okay, here's the info, study it, learn it, we're going to test you, and then forever you will remember that and use it. Well, the reality is that's just not what happens, right? This big drop off here is the forgetting curve. And study after study after study has shown that as quickly as within 30 days of a learning event, the average learner could forget up to 80% of what they learn in that event. So you could look at it from the financial side and say, wow, 80% of that money we spend on that training is thrown out. You could also look at it from a productivity standpoint where, okay, beyond that 30 days, our folks in the field really aren't doing what they should be doing. So productivity is going to be way down. And I'm sure a fair amount of this audience can relate to that. Some of us may not even remember what we had for dinner last night. Things are so crazy. And this challenge, this problem of forgetting, more and more people I talk to relate to, because these days, especially, there are so many distractions, whether it be technology oriented, whether it be the fact that, we're working from home and we're trying to balance so many things all at one time. It's a known issue that we have to deal with. But the good news is that there are ways to reset that forgetting curve. Research and evidence has proven that there are things that you can do to essentially reset that curve. Excuse me. The technology-focused environment that we particularly play with allows this to be done efficiently and helps to make needed information available in a real-world or just-in-time context. As Ryan Cooper, who spoke first thing this morning from Learning Pool, mentioned, learning should be in the flow of work and not feel like learning. And, I agree with that for the most part. The process of continuous learning, the process of refresher training, things like that, absolutely should be in the flow of work and almost feel like I'm just doing my job. And guess what? I'm remembering, or I'm learning something slightly different in a way that allows me to reset and essentially get over that forgetting curve. Okay, let's talk a little bit about some of the tactics that our clients use to effectively train their folks and address those challenges. Self-study learning, really, certainly a big part of what we've been talking about today, and that could be e-learning. We do a tremendous amount of e-learning developing with our clients, and the trend that I'm sure a lot of you realize is to not make these massive e-learning modules anymore. Don't make them any longer than they have to be. The shorter, the better. And really make sure that that learning is tied directly to specific learning objectives. Complex topics like disease state, we use e-learning for, product information, ethics, can all be taught in an engaging manner within interactive e-learning modules. The key is with any training is to make sure it is relevant and engaging, and no longer than it needs to be, as I mentioned, to address specific learning objectives. All right, collaborative learning environments. You may be getting a sense or will shortly that we are big fans of blended learning. Certainly e-learning is a big part of that, but a truly blended approach. Collaborative learning environments. I don't want to just call these workshops or presentations because, and I think this, David Kelly may have touched on this idea of collaboration as well. Collaborative learning environments like live workshops, and hopefully they will come back someday, and small group sessions, virtual sessions have also been proven to provide training that helps to drive desired results. Given the pandemic that we're all involved in currently, certainly majority of this training has been delivered virtual, which in and of itself brings in a whole list of other challenges that our clients are facing. The facilitator or instructor is critical when doing training in a virtual setting. Tactics such as breakout rooms. Someone just recently mentioned that, and formats that foster discussion rather than just presentation work best. Our industry relies a lot on, for training and reinforcement and support, very heavily on the manager. Quite often they're called district managers or regional managers, and sales representative or sales specialist interaction. Given this current environment, that type of coaching and support is being done virtually, understandably. This is a good example of something that David Kelly had mentioned in the previous session about how we need to make this conversion. So these interactions that used to happen between the manager and the rep, which were done in person, whether it be at a coffee shop or in a car, they're now being done virtually. And they're still happening, they're still collaborative, they're still very effective and still very much needed. So collaborative learning environments is certainly a tactic that we are developing for our clients. And very quickly, when the whole pandemic shift came in and the world shut down and our learners could no longer see their customers, all of a sudden we were getting calls, quote unquote, the phone was ringing off the hook from our clients to say, okay, we can't send these folks out in the field. They can't even really call on docs right now. We need to develop training. We need to look at what we have in our stable and how can we develop and move around our curriculum strategies and plans to make sure that they are using their time wisely and learning new things. So that getting back to what someone had mentioned about new opportunities, that was a great opportunity for our company. It allowed us to not only to dig in deeper with our clients, but really work with them and provide a lot of value in kind of shifting and restructuring their learning curriculum. Okay, sustainment and reinforcement is directly in support of the forgetting curve, the forgetting problem. Some of the tactics that are used in our industry as part of a continuous learning and retention plans include quick reference guides, key fact cards, and what we do is quite often within our e-learning modules, let's say it's a 20-minute learning module on a particular disease. At the end of that will be a key fact card that they can either print off separately, can even quite often some of our clients will allow us to install it in some type of support app that they may have. But the point is that it's this reference material that they can use later. Podcasts. Podcasts are something that are a big part of what we do. It allows us to use the right delivery mix. By adding that to essentially the menu, it allows us to make sure that we're using the right medium to deliver the information. So for example, an interview with a physician on a given topic is a great use of a podcast. Having someone from the medical group within our company speak to a specific mechanism of action or something related to a drug or even a compliance issue. Again, a real good use of podcasts for sustainment and reinforcement. Annotated documents. As I'm sure you can imagine within this space, there's a lot of documentation, prescribing information, that long sheet of paper that comes in that prescription that you get that no one ever reads, or if you do, it's difficult to understand. Well, that is really the primary source of information for sales representatives and what they can speak to with physicians. In other words, that's their guidelines. They cannot speak beyond the information that is in that PI. So we do a lot of training around PIs, both as for primary learning, and then even have tools that allow that information to be available kind of just in time as a resource. Competition comparison guides. Competition is another really strong topic that we train a lot on, infographics and job aids. And then the final tactic that I want to just touch on today is communication. Communication is a big part of what we do. And I just don't mean communication directly in the learning, but communication around the learning. Communication plans use a variety of assets to really get the message out. They're essentially little marketing campaigns or awareness programs. So videos, templates, PDFs, posters, things like that can all be used and are really critical to make sure that learners understand the benefit of the program, what's in it for them, when they need to take and go through the various learning assets, and essentially the overall benefit they're going to get out of it. They're adults, right? They want to know, okay, what's in it for me if I'm going to go through this? All right, on to strategies. There are a whole host of different strategies that we use with our clients to help them not only design learning plans, but then execute on those learning plans. And this is one example. And this example is really focused on, this example is focused on training new knowledge. It was leading up to the launch of a new product. And as you can see by this image, it wasn't just a quick one and done. This was a 5-month training program. And by the way, this program actually won our Brandon Hall Award. If anyone's familiar with that organization, we were thrilled with that, and so was our client. But the whole idea was that our audience were busy people. They had their day jobs. They were already selling in this space, so we didn't have to start from ground zero, but there was a lot of information, new information that had to be conveyed to them. So we designed this plan that used a variety of the assets that I touched on before: e-learning, podcasts, micro-learning tools, different question sets, virtual. That was all part of the mix over this 5-month program. And the idea was that over this period of time, any given week, the training was anywhere between 60 to 90 minutes. So we didn't overwhelm the learners. They were able to take this 5-month program over a period of time leading up to the launch meeting and really be prepared to apply, to demonstrate how they apply this knowledge at that launch meeting. Okay, time for our little poll that I want to ask everybody. And this kind of goes back to that silly image that I had shown before. So thinking back, jog that memory a little bit. What color was the cow that I showed on screen? Was it green, orange, purple, or blue? This little exercise may help to demonstrate how quickly we can forget what we recently learned or observed, or maybe just tell me you're not paying attention. I don't know. All right, we'll give everyone a few seconds to vote, and then let's share those votes. Wow, a lot of you were paying attention. Great, purple, thank you. And remember that, so that forgetting curve didn't quite set in yet. So thank you for sharing that information. A few of you, okay, you thought it was green, the others thought it was blue. Thank you everybody for not picking orange, because there was not an orange animal on that screen. All right, moving on. Back to the learning strategies. Okay, this particular type of learning strategy involves campaigns. And it's not a campaign, and I know we're all a little tired of campaigns right now, but it can be a very effective strategy to use in an ongoing or continuous learning environment. As I mentioned, learning should not be considered one and done. A learning strategy that can help our clients with design and implement something that ensures knowledge and retention and application certainly can really have a huge impact on the overall learning program. Excuse me. The campaign approach leverages something that the advertising industry has known for a long time, that spaced repetition, excuse me, spaced repetition can really help people remember things, right? You see something over and over again, or you extend the story over a period of time. you ultimately remember that story. And this visual shows in a month period how, okay, you can roll out an assessment. You can, early in the week, you can follow that up with micro lessons. And these are all learning objective specific, but all part of the same bigger picture to help kind of tell the story. You can even introduce games the next week, and then maybe follow that up with a game the following week. The fourth week in this month, actually, there would be start with maybe some micro lessons, could be some short videos or really small micro learning modules, and then followed up with review and reinforcement. Another example of a learning campaign, and this is certainly a bigger picture, is where this shows the entire cycle, so to speak. So you start with a learning event. Again, it could be a comprehensive video program, e-learning module, a workshop or virtual session, followed up by personal, well, actually there's this knowledge check or even initial mastery certification. So you kind of get a baseline of what they know. Then there are ways to develop personalized learning that come out of that. So essentially you identify where there are knowledge gaps, and then you can send out personalized micro lessons that directly relate to the learning objectives where people have gaps. Then continuing beyond that, you could do another, in this case, do another mastery certification. You don't have to, but then beyond kind of this remediation phase, you then move into the sustainment phase. And that's where you have these different micro lessons or different types of activities that go on for a period of time. It's all scheduled and it's all part of the campaign. All right, Suzanne, I know we're kind of getting close on time. Thank you for coming back in. I think I'm very close. I just want to talk about some best practices, if I could. So some things that I want to kind of share and close my presentation with that we really stress with our clients and even colleagues in the field. First, certainly plan a multi-asset learning strategy. Again, it's not one event, it's not one type of thing, it's not one technique, it's a variety of things that really should be all part of your learning plan. Design the learning so it helps to reset that forgetting curve. Don't just push that aside. Don't plan to address that later. When you're thinking bigger picture, you should be thinking of sustainment to help make sure that learning curve isn't really an issue. Use multiple delivery formats. On that bigger grid, you saw there are a whole variety of things. One of our clients said, that's a really diverse training plan. And it is, because there's different techniques, there's different assets, which help with engagement, help with to offset learning fatigue. There's a variety of advantages to really looking at a multifaceted approach like that. Communication. As I briefly touched on, communication plans are a big part of what we do, especially with larger learning initiatives. You need buy-in on the part of the learners. A communication plan can certainly help to make sure that happens. You want to make sure the training is easy to get to. LMSs certainly continue to be a big part of our industry, but even that's changing. Whatever the delivery platform, whatever the delivery modality, you need to make sure that learners don't get frustrated and have easy access to the learning. You need to essentially demonstrate that the value to the learners, that the value, that you value their learners' time by allowing them to integrate the training into the busy schedule. Even the session, Suzanne, just before this one, we're talking about kind of how work has shifted, and things have changed around with respect to how people are working. Well, you need to keep that in mind with learning too, that you have to realize that you need to respect and work the learning in to everyone's busy day. So with that, I think I'm 2 minutes over, so I apologize for that. But
that's
I hope
okay. We started you a couple of minutes late, I think. So you're fine. You're fine.
Great.
We're glad to have that information. And I think your visuals were really effective. Number one, I'll never forget the purple cow now. And showing kind of those charts of the different types of learning. And I love the fact that you can personalize the learning based on what the user is comprehending. I think from a global e-learning perspective, that's certainly worth consideration, because so many organizations just throw out the learning and push it out to the end user without really understanding how the digestion of that information works. So
You're
really
right.
good stuff.
Well, thank you. Yeah, there are a lot of different platforms and so forth that automate that process. And I'm not talking about virtual or augmented reality, but simply, okay, you align your assessment questions with learning objectives. Someone fails a learning objective, the system can automatically assign remedial micro lessons. Not massive learning, but these little nuggets to help them with specific items. So yeah, it's really continues to be an exciting time. Again, I really very much appreciate this opportunity. I hope this has been helpful for folks watching, and look forward to the rest of the day.
Really good stuff, Pete. Thanks so much for joining us. And for questions, what we're going to do is move Pete over to the live after party, and attendees feel free to join him there for questions. The live after party link is on your screen. And reminder that you can only join one Zoom meeting at a time, according to Zoom. So you will have to exit the webinar and just come back in when you're done at the after party. So thanks again to Pete for all that information. Good stuff. And now we're going to be welcoming our next speaker.